and also the data is up to 26 weeks, which is the primary endpoint of both studies. And I will give a very brief introduction of the two studies. For the GBCG study, it's a multinational double-blinded randomized trial to compare a monotherapy of both doses of dulaglutide versus SU glimepiride. And as the patient is already naive or taking one drug with the dose less than half of the maximum dose. And for the GBDK study, it's actually in the OAD failure patients to compare dulaglutide both doses versus insulin glargine adding on to metformin and SU. The primary analysis is 26 weeks and final analysis is 52 weeks. And here is the baseline characteristics of the patients. We could see that the characteristics are similar between treatment groups in both studies. And we can see that in GBCG study, the baseline HbA1c level is around 8, while in GBDK study is around 8.3. And also, there's a very interesting part is for the BMI study, which is a BMI level. So in Chinese population, the BMI is around 25 to 26. And also for the diabetes duration, we can see that patients in GBCG study is a bit earlier. The duration is around 3 to 4 years, while in the GBDK study it's around 7 to 8 years. And we can see the HbA1c level reduction and the PPG level reduction. Actually, superiority was achieved in both studies of both doses versus the comparator in SU versus glargine. And also, we could see the significant reduction in PPG level. The data is derived from the SMBG data in both doses versus the comparator. And then we go to see the association of the reduction of HbA1c level and also PPG level. We could see that from this bar chart, this is a proportion of patients who have the HbA1c level less than 7%. And we calculate the percent who also achieve PPG level of less than 10 millimole. So the proportion of patients also on PPG target is higher in both dulaglutide doses versus the comparator. And also we did a scattered gram to show the association between the reduction of HbA1c and also reduction of PPG level. So here the axis shows the HbA1c change from baseline. So if it is less than 0, it will have a reduction. And this one will be the PPG reduction. So we will focus on this quarter, which is the left and the lower quarter. Patients both have HbA1c reduction and PPG reduction. We could see that 82 to 83% of patients treated with dulaglutide 1.5 milligram will achieve HbA1c reduction and also PPG level reduction. And for the 0.75, there's 76 to 80% of patients achieved both reduction, while the patient achieving the both reduction is less in glimepiride or in glargine group. Then we come to the conclusion. Actually, we could see the HbA1c reduction in both dulaglutide group. Therefore, dulaglutide can be a viable treatment option for Chinese type 2 patients. And also, we see the association between HbA1c reduction and PPG reduction in both studies, which further support a strong effect of dulaglutide in PPG control.
Thank you very much.
Thank you.
Thank you very much for